squint, cheeky smile. So because she kind of, permeates all around here, we're just gonna start just lateral to the frontal bone and come all the way around, sneak underneath here, try to capture some of that crepiness that happens in the under eye area. We obviously don't want to come in through here. That's more of a filler treatment that we'll do at a later date for Jen. She doesn't like her frowning activity. Kind of gets a little crepey through there. And then raise up your eyes. And then she just wants me to soften some of those lines here. This is not awful, so we just stay a little bit lighter on our dosing up here. But that's it. So we're gonna wipe her down with a little bit of alcohol. And just close those eyes if you want, Jen. Sometimes the alcohol makes your eyes water a little bit. Patients are always apologizing when they come in with makeup, and I tell them, it's not a big deal. We can wipe it off. You can always touch it up afterwards, but we usually ask our patients to give us a little bit of time, at least a half hour to an hour with Botox treatments before they put any sort of makeup on there. And if you're squeamish with needles, look away. But it's very tolerable. I'm just gonna wash my hands, and then I'm all hers. All right, my friends. So I usually tell patients that a Botox appointment should be about 30 minutes. That gives us ample time to talk about your goals, talk about your concerns, and then that way we're not rushing through anything. We took photos already, so we always like to document your photos prior to the treatment. And it's not for us to share unless Jen, of course, has given us permission to share her treatment today with all of you. But it's just so that we can document the progress of your treatments in your medical chart. So with that being said, when we take your photos, it doesn't mean that you're going to be plastered on Facebook unless you give us permission. So first things first, you always have the patient animate, go ahead and frown like you're angry at me. So we're going to do 5 little pokes, 1 in the center, 2 on either side, and then another 2 for the tails of her corrugators. Go ahead and close those eyes. Little pinch, breathe. Nothing too crazy. On a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever felt, how was
1.
that? Not even crazy, right?
Yeah.
Little pinch again. Little pinch. And I'm using my thumb on my non-injecting hand to act as a stabilizer. Little pinch. And keep any of our product from reaching that ocular space. We don't want our Botox to come down into those intraocular muscles. All right, now raise those eyebrows up really high. And then she's got a little bit more pull here and here. So I'm gonna focus a little bit further out, little pinches. So even though we're treating similar muscles from one patient to the next, it doesn't mean that every treatment is exactly the same. We study your muscle activity and we treat accordingly. And every once in a while we get a little bloodshed, nothing crazy. And then it's common for patients to look like they have little mosquito bites on their skin right after Botox. That's totally normal. Same thing with Dysport and Xeomin. They're all the same product. And basically it's just a tiny little wheel of the product. Perfect. Couple more pokes around her eyes and she's done. Still pretty comfortable?
Mm-hmm.
Go ahead and turn so Jen can kind of see what we're doing here. So go ahead and give us big winks at the sun. And then try to wink at me like you're going.
Can't do that.
So you can see how she starts to have some starburst pattern here and comes down through here. So little pinches. Sometimes these areas bleed a little bit more just because there's more vessels, but we're going to try to work around those if we can. And again, you can kind of see little tiny blebs on the skin. And that's perfect because the skin is really thin. Sorry, girl, that one stings the most. Last little poke right here. The skin's really thin and the muscle's really thin, so we want those little wheels so that we know we're in the right plane. Perfect. Big winks at the sun. Perfect. Yeah. Little pokes. Little pokes. Any comments, Jen?
You're doing great.
Oh,
You
me?
Both of you are, Jen. No, I meant you.
Everything looks amazing.
I'm used to you being like the loudest one
I
on
know, I'm trying not to
on the video.
I know.
And she's done. So you guys also kind of saw her squirm a little bit. These pokes underneath here, they
Yeah,
always sting
those are
quite
the
a bit
main
more.
ones hurts. And you know what's crazy is pokes on this side of my face, I feel more ever than on this
Mhm.
side.
And I don't know, I'm sure there's probably a study that shows like more sensation, but most patients will comment that the right side is a little bit
It's
more
how
tender
laser is too,
than the
though.
left.
Everybody says that about laser too.
Totally
It's
normal.
so weird.
Done and done. So aftercare for Jen, we tell patients to stay upright for the next 3 to 4 hours. We don't want them putting any direct pressure on their face. So we say no massages, no facials, nothing to where you're purposefully massaging the area. She can wash her face normally tonight. That's totally fine. We just try to comment to the patient, like, we don't want you doing anything that would kind of move the product from where we just put it just now. So any tight ball caps, we would have you stay away from doing that as well. Typically for Botox, in about 3 to 4 days, she'll start to see that product activating. Dysport activates just a little bit sooner, so usually 24, 48 hours, patients are commenting that they see it starting to take effect. All of the products, Botox, Dysport, and Xeomin, all of them are fully activated at 2 weeks out from the treatment. So that's why we usually have patients come in about 2 weeks post-treatment. That way we can see everything activated, and if we need to make little tweaks, we can. So common things that happen, maybe a little bit of a Spock brow, maybe one side took a little bit more than the other. For the most part, those are few and far between, but they can happen, so don't think that it's anything that we did wrong or that you did wrong. We always like to be more conservative, therefore we can always add more, but we can't take away. So I think from a general rule of thumb, you'd always want to be with a provider that's more conservative than they are aggressive. But I think this is Jen and I's first date, so this is the first time that I'm treating her. We talked through her concerns, we talked through her goals of what she wants to come out of her treatment, and I think that's why it's important for us to spend those quality 30 minutes to sit down and have that conversation. I asked Jen to come back and see me in 2 weeks, so for a second date. So if we need to make any adjustments, I know that it's already on the books and we can take care of it, but I try to wait until that 2-week mark so that I know that everything's activated and we're not over treating an area that's maybe still activating. So in all, all of those little bumps are already starting to go away. So I usually tell patients, usually about 10 minutes post-treatment. This is something that it's a lunchtime procedure, so you can absolutely come in on your lunch break from work, get it done, and then go back to work and nobody will know anything different. Some people like to be secretive, some people want their friends to know, so you can choose, but you don't have to disclose if you don't want to. So thank you so much for letting us take
Thank you.
your treatment.